It's Wednesday, September 25th, and this is the Daily Medical News, where we bring you the top clinical medicine headlines and a closer look at the day's biggest story. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, vitamin D supplementation looks ineffective in healthy adults.
Auto realignment helps boost the number of Americans with health insurance.
There are more women in internal medicine residency positions, but fewer in subspecialty fellowships.
And why responsive parenting may get better results than hugs alone.
Plus, many institutions are using higher than recommended levels of radiation during lung cancer screening.
Supplementation with vitamin D3 appears ineffective at improving bone mineral density in healthy older adults. Those are the findings from a study of more than 700 healthy men and women with an average age of 63 years. Researchers reported the results at the annual meeting of the American Society for Bone and Mineral Research. Study participants were not on any bone-active medications and were randomized to receive either daily vitamin D3 at a dose of 2,000 international units or placebo. Over 2 years, the vitamin D group's total 25-hydroxyvitamin D levels increased, while the placebo group's levels stayed the same. However, the researchers found no significant absolute percentage changes over 2 years in areal bone mineral density of the whole body, femoral neck, total hip, and spine compared with placebo. Why no change? The researchers suggested that these healthy adults may have already reached the vitamin D level needed for bone health.
More people remain insured when they are automatically re-enrolled in their health insurance, compared with people who had to handle re-enrollment on their own. Those findings come from a study published in JAMA Internal Medicine, and it comes at a time when officials at the Centers for Medicare and Medicaid Services are considering eliminating automatic re-enrollment in the Affordable Care Act marketplace plans. Researchers looked at more than 100,000 households in California that enrolled in a marketplace health plan. Less than 1% of households were not automatically re-enrolled in plans because their insurer left the state. Of those households not eligible for auto re-enrollment, their enrollment rates were about 22%. That compares with a rate of more than 50% for the households that were auto re-enrolled. The researchers adjusted the re-enrollment rates based on a number of factors, including age of the oldest household member, household size, and insurance subsidy. The researchers said changing the auto re-enrollment policy for the ACA's health insurance marketplace would likely leave more Americans without insurance, but more study is needed.
Over the last 25 years, women have become a more significant portion of the residents in internal medicine, but the same can't be said of subspecialty fellowships. A new analysis published in JAMA Internal Medicine found that from 1991 to 2016, the percentage of women in internal medicine residency programs rose from about 30% to 43%. The story is different in subspecialty fellowships, where overall proportion of women fell from 33 to 24%. Dr. Anna Stone of St. Vincent Hospital and Heart Center in Indianapolis is the lead author on this study. She said many factors are associated with the decisions of medical students in choosing an internal medicine residency, including educational experience, views of patient care, and lifestyle perceptions. And similar considerations apply to subspecialty training. When the researchers zeroed in on 9 subspecialties of internal medicine, there was growth among women. Although none of the 9 subspecialties had been majority women in 1991, by 2016, women made up more than half of the residents and fellows in 4 areas. Those areas were endocrinology, geriatric medicine, rheumatology, and infectious diseases. The figures used in the analysis come from the Accreditation Council for Graduate Medical Education. We'll be right back with the Daily Medical News after this message.
A new meta-analysis holds some clues on what parents can do better to promote language development in their children. Dr. Sherry Madigan of the Department of Psychology at the University of Calgary worked with colleagues to analyze 37 studies that evaluated the association of parental sensitive responsiveness, warmth, and children's language skills. So-called sensitive responsiveness is a parent's ability to perceive and interpret a child's cues and respond promptly and appropriately. Warmth, on the other hand, refers to a caregiver's physical affection and their positive affective quality when in contact with their child. Across the studies, researchers found a stronger correlation between sensitive responsiveness and language development than between warmth and language. The researchers explained that a sensitive, responsive parent can build on the moment-to-moment shifts in a child's attention, and that neural development is thought to occur through their finely tuned reciprocal interactions. Warmth, in contrast, does not involve reciprocity, they said.
A significant proportion of institutions that perform low-dose CT for lung cancer screening are exceeding recommended radiation dose levels. That's according to new findings published in JAMA Internal Medicine. The Centers for Medicare and Medicaid Services requires institutions to use low-dose techniques and to participate in a dose registry in order to be paid for lung cancer screening. The American College of Radiology recommends that lung cancer screening scans have a volume CT dose index of 3 milligray or lower, and an effective dose of 1 millisieverts or lower. To see if hospitals and other facilities were adhering to these standards, the researchers collected data from 72 institutions and about more than 12,000 patients undergoing CT scans for lung cancer screening. The researchers found that 21% of institutions had a volume CT dose index value higher than the American College of Radiology guideline, and 65% had a median adjusted effective dose higher than the college's guideline. The observational study wasn't designed to address causality, but the researchers did find certain institutional characteristics were associated with using higher levels of radiation. This included allowing any radiologist to establish CT scan protocols. Changing hospital policies to allow only lead radiologists to establish protocols for CT dosing could have a meaningful impact on the amount of radiation used in screening, according to the researchers. And that's it for today's Daily Medical News. Remember, you can find us on Apple Podcasts, Google Podcasts, Spotify, and YouTube. For MD Edge, I'm Nick Andrews.
And I'm Mary Ellen Schneider. Thanks for listening.